keynote speaker tonight is former Surgeon General Dr. Joycelyn Elders. Dr. Elders was the first African American woman to hold that post. She's now a distinguished professor of public health at the University of Arkansas. A couple of interesting things I learned about Dr. Elders is she never saw a physician until her first year at college. And she also was awarded a scholarship by the United Methodist Church to attend Philander Smith College in Little Rock, Arkansas at the age of 15. And she graduated when she was 18. Phenomenal. Upon graduation at 18, she entered the U.S. Army and was a first lieutenant where she received training as a physical therapist. After her service, Dr. Elders attended the University of Arkansas Medical School on the GI Bill. And after graduation, she was an intern at the University of Minnesota Hospital in Minneapolis and did a pediatric residency and a endocrinology fellowship at the University of Arkansas Medical Center in Little Rock. She ascended the academic ladder to full professorship after a fellowship and board certification in 1976. She also holds a Master's of Science degree in biochemistry. Dr. Elders joined the faculty at UAMS as a professor of pediatrics and received board certification as a pediatric endocrinologist, easy for me to say, in 1978. In 1987, she was appointed the director of the Arkansas Department of Health, and while serving as director, she was elected the president of Association of State and Territorial Health Officers. She was nominated as Surgeon General by President Clinton in July of 1993. She was confirmed on September the 7th and sworn in on September the 8th. During her hearings, Dr. Elders stated that she wanted to change the way we think about health by putting prevention first, and to be the voice and vision of the poor and powerless, to change concern about social problems that affect health into commitment, and to make sure that every child born in America is a wanted child. Dr. Elders has won numerous awards, including the Arkansas Democrats Woman of the Year, the National Governors Association Distinguished Service Award, the American Medical Association's Dr. Nathan Davis Award, and the National Coalition of 100 Black Women's Candidates Award for Health Science. If you would please join welcoming and joining Dr. Joycelyn Elders.
Thank you, President Smith, for that very elegant introduction. What they told me they wanted me to do was talk about myself and leadership. Well, I don't know anything else I can say about myself when your president's already said everything that there is to say. But, you know, I've never been known not to say anything. First of all, I want to tell you it's just a real pleasure for me to be invited by Census Technology to be a part of your 9th annual Users Conference. It's a pleasure for me to be here and see so many of the users, the managers, the software developers, all the things that you've been out there doing to make medicine a better place and to transform how we take care of patients. It's because of all the hard work you do. It's all the development that you go through and all that you're going to have to continue to do. I'd like to say you've done enough. But I want you to know that in healthcare, our job is never done. It keeps going all the time. We've come a long way, but we still have a very long way to go. I said I was coming and I worked very hard to prepare all these beautiful slides that I was going to be popping up showing to you. Well, Many of you out there know what it is to have when your hard drive crashes. So I had it all, it's all prepared. I even have a printed copy, but I was gonna put my, my flash drive so I could show you. Well, you aren't gonna see that, so you have to listen to me. Somebody told me one time, said, well, Dr. Elders, what you're gonna have to do is talk to the people rather than talk to your slides. So that's what we're going to do this evening, and we're going to ask questions. We're going to have a kind of interactive conference, and we're going to talk about what it is we want to do, what it is we need to do, and where it is we need to go. Where are we, and where do we need to go? We know a lot of things. There are a lot of things we know. We know that our population is changing. First of all, we're growing older all over the world. And we old folk need more health care. We need a different kind of health care, and more of you are going to have to work to pay my Social Security. So that's a fact, and it's increasing all the time. And the second thing is, we aren't as smart as we used to be. As we go, one of the things you have to know as you grow older, you cease being as smart as you are. You may be wiser, but you don't think as clearly. And it's, in fact, I tell my brother, I tell him all the time. He says, I pray to God every day that my body don't outlive my mind. And I bet there's some of you in here know that there are some people that whose bodies have really kind of outlived their mind. At the age of 65, 3% of us have some evidence of Alzheimer's or dementia, but it increases 5% a year, every 5 years. So it's ever increasing. By the time we're 85, and I want you to know I'm 86 now, 30% of us have elements of Alzheimer's and dementia. So you'll need to start looking for that, and you'll need to start thinking of that and planning for that, planning to take care of old folk. The second thing, my brother said he prayed to God for, he says, I pray to God that I don't outlive all my mourners, because I want somebody to come to my funeral. So I think that we all think that, but we all want to live forever. We're never quite ready to go. And last thing he said, I pray for, he says, when I get down to the river of Jordan, that I don't drown in shallow water by being not able to think, not able to plan, and being fearful and not a kind of person that I want to be. So those are some of the things that we know about population. We know that we live in a country where we are the most diverse country in the world. We have 28 different languages, and and we know that when we talk to our patients, our customers, our users, or whomever we're talking to, if they can't understand you, they can't do what you say. And that's true for our patients. So we have to make sure that we're able to communicate with our patients, and they're able to understand what we're talking about so they can continue to do what we're saying. We also know that one of the things that our diseases are changing. It used to be that all the diseases were acute diseases. Now, what percent are chronic? 75% are chronic. We're talking about with old folk. We old folk with high blood pressure, high cholesterol, dementia, arthritis. We go to bed with Arthur. We get up with Arthur. So we know that he's always around. And so these are the things that we know and that we've got to plan for. And we've got to make sure that we planned in the future, that we are thinking about all of those factors. And we know that most of our health care costs, what we know about our health care system, it costs too much. It delivers too little. And we have too many people who don't have access. Just think about it. We're the richest country in the world. 5% of the population of the world, which is it's about 8 billion now. It said the world population, we're going to take care of 9 billion. That we have to address that. We in the United States, we're at 330 million. So we're only 5% of the population. And we spend 25% of the wealth on health care. And do we have the best health in the world? No. We rank number 67th in overall health of this developed nation. So we spend loads of money on health care, but we've got to spend more on keeping people healthy. And you can do more to keep your own self healthy than all of those neurosurgeons and all of those doctors out there in the past 100 years. This is something you've got to do. And you've got to help us. We've got to educate our people on how to take care of their own health. And we want to improve the health care of this nation. We know that we have a lot of disparities in health. We have disparities, we old folk feel you disparage against us as compared to young. We have sex disparities, we have racial disparities. And many of us say, well, I'm not a racist and all, but we all carry a certain number of isms on our back, and this transports over into health care. So these are things that we all have got to be involved in doing and making a difference. And we can. You can make a difference. You've done a lot. When you think of the goals of the nation, all of you already probably know what the goals of the United States are. You know we haven't accomplished it. What are the goals of the nation? We want to make sure that we have healthy people and healthy communities, and all people in this country have the best health that they possibly can. Well, we know we haven't accomplished that. But we've got to work on that, and we are. When I look back and think of my own life and think of what my life was, and think of leadership, and all of you are having to be transformational leaders. That's what you're training to be. That's what you're about. That's what you're doing. And a transformational leader is one who transfers and causes things to change, and a leader who can lead and others want to follow. And I think when you heard your president and CEO talk about where this company has gone in the past 10 years, that's because he's been a transformational leader. He's been out there leading. He's been a visionary leader, purporting visions, and he's got all of you following him. If you weren't following it, you wouldn't be here today. So I'm saying you are about making change, making a difference. I don't know if I was such a good leader or visionary leader, but when you're old, the oldest of 8 children, from a very, very poor family. And the only way you can eat is everybody has to really work hard and do their job and do what needs to be done. Well, let me tell you about my 7 sisters and brothers from this we grew up in a 3-room shack. No running water, outdoor privy. The one thing I did have is I had 2 sets of wonderful grandparents, 13 aunts and uncles on one side, 18 on the other. So you can see I had a huge nuclear family that was out there behind me and supporting me. But when I got ready to go to college, nobody in my family had ever been to college before me. And the United Methodist Women offered me a scholarship to Philander Smith College. That's a small black college in Little Rock, Arkansas, and this college only took the valedictorians and salutatorians, the top 2 students from the black schools, not only, but that was, they offered those people scholarships. So they may have been the best in the world, but they were the best of the black students that was in graduating from black schools. We're talking about, you have to realize I graduated from high school in 1949. That was a few days ago, before most of you were born. So, but it was a very long time ago. And things were very different then. But when I was offered this scholarship, I want you to know that we didn't have the money for me to get for bus fare to get to Little Rock. Bus fare was $3.43. That may sound like a zero to you, but you have to remember, when you have nothing, $3.43 is a great deal. That was back when a loaf of bread was a nickel. So my brothers and sisters picked cotton, scrapping cotton. Most of you don't even know what cotton is. But in the field, picking cotton to get my bus fare. They'd worked hard all day. At the end of the day, my little brother, he was probably 5 or 6 years old at the time, must have been 5. He looked up, it was almost sundown, it was getting cold. He wanted to know, do we have enough yet? Not in a mean way, not in a way that he wasn't going to continue to work, but saying, wanted to know if we had enough. At that moment, you know, we talk about transformational moments. We all have transformational moments for all of us. At that moment, I looked down at my little brother and my other sisters and brothers feeling equally tired, having worked hard all day. And I said to myself, I said, if I ever get out of the cotton patch, I'm going to make sure that my sisters and brothers, any of them who want to go to college, I'm going to help them. Well, I want you to know, I got out of the cotton patch with a lot of hard work, and my mom always told us, all of us, that if you want to get out of the cotton patch, you've got to get something in your head. So every one of us grew up with that thought. And so my younger brother, when he was 4 or 5 years old, he had, I'm sure, what was a ruptured appendix. His abdomen was markedly swollen. He had fever. He was grunting. And he wanted to know. My mom told my daddy, she says, Curtis, you've got to take my baby to the doctor. The nearest doctor was 13 miles. We had no car. So my dad hooked up a gurney and took my brother on the back of a mule for 13 miles to the nearest doctor. And the doctor, the nurse showed compassion and put him in a room because, that was during the time when everything was segregated. And told my brother, the doctor said, we'll see him as soon as I can. He lanced his abdomen, put in a huge drain. It seemed probably wasn't nearly as huge as I imagine it now, but it's, when you're 11 or 12, everything gets to be huge, and sent him home. He had a ruptured appendix, and he had peritonitis. He would die if he was treated in that way today. But I'm saying, but this doctor treated him and told my mom how to pull this drain out ever so much every day. My brother lived, and he grew up to be a veterinarian. And he went to Tuskegee. People said, well, why did he go be a veterinarian? I said, well, that's how you treat animals and hogs and cows. And so this was what he thought. But so I'm very pleased with my brother. He went to Tuskegee. He was a veterinarian, and he did very well. So I'm telling you about my sisters and brothers. My other sister, I had a sister who was human resource person for Ford Company for years. Another brother who worked for General Motors for 53 years and missed 3 days of work in 53 years. We always teased him. He said he probably made more money than all of us, but this brother had a learning disability. But he was a good person. He hard work. His heart was in the right place. He wanted to do the right thing, but he was not able to go to college, because he. And my third brother was the one I told you about, was a veterinarian. My fourth brother, I told you how he's praying that I live and don't die too early. But he became a minister. He didn't know how to read. The only book we had in the house was a Bible. And my mother taught him how to read from reading the Bible. And so he became the secretary for race and religion for the United Methodist Church for the world. So I'm bragging a little bit. So if you were, and I told you I had 8. That was my 5th one. My 6th was a sister who was the smartest one of us. If you based them on IQ tests, she became a teen parent, but she's still the smartest one of all of us. And she said she had all the common sense. And so and my next sister is a linguist. She got a PhD and was on the faculty at Howard University. And my youngest brother is a wonderful auto mechanic, and he helps design race cars, and he still does that. So I'm saying they all really did okay, and I want you to know I'm very proud of. But I feel that I was very influential because I always felt if you work hard and get to the top of the ladder, make sure you send the ladder back down for the rest, those that are trying to come up. So to me, that's what we have to be about. And we have to always be out there sending the ladder back down for the people that are training. Some of us we are doing well, everything's going well, we're at the top, but we don't want to tell anybody else. But we have to make sure we send the ladder back down for all the rest. I mentioned that we've had a lot of problems in healthcare, and we still have. Some of our major problems that we have today still have. I mentioned about my brother with problems with access. We still have problems with access. We still have problems with high quality. That not everybody has the same quality. And we still have problems with financial access. Not all people have financial access. But the most important thing we've got to do is we've got to deal with our health care system. We have a health care system for the rich and a sick care system for the poor. We've got to make sure that we make, if we're the richest country in the world, there's no reason that we can't provide good health care for all of our people. And it's far cheaper to do that because the most expensive care in the world is sick care. If you don't believe it, go to the emergency room and you'll find out how really expensive that kind of care is. And I think the thing that you're doing, remember, or you probably don't remember, when we had to count and label and make sure all of those instruments that you're now managing with your computers, your software, and all the things that you just do by pushing a button. Well, that's because of the wonderful technologies that you've developed, that you continue to develop, and that we must continue to develop. And whereas we've accomplished a lot, I want you to know it hadn't been enough. We've got to continue to educate, educate, educate. We can't keep a stupid population healthy. We've got to educate them about their mental health, about their nutritional health, about their sexual health, about their exercise, the simple things we do. There are 7 simple things that the government spent $11 million to tell us to do. They didn't spend, and do you know what they are? They're 7 characteristics of healthy people. And you all know what they are. Most of us don't do it. Look at me. Too fat. We need to eat breakfast, eat 3 meals and 3 snacks. Consume a low-fat, low-saturated fat diet. Make sure that we get 7 to 8 hours sleep at night. Not like our teenagers who feel that they can party all weekend and catch up some other time. You catch up, but you don't catch up. Your brain needs to go to sleep too. The other thing I think we need to that we make sure of is that we practice safe sex. Do you know that we had the highest we still have the highest teenage pregnancy rate in the industrialized world? And children born to children are more likely to grow up less well educated. They often don't finish high school. They're often poor. And they don't know how to parent. We complain about our children not being able to parent. So these are all problems that we go through. Don't drink. I know you're having a big meeting, but men get to have 2 drinks a day. 2. Women only 1. Men metabolize alcohol much better than women. So we have to know that, but I also keep in mind that we can't drink too much. And the other thing is we are having an opioid, a drug and alcohol epidemic. And this is a part of influencing our health problems that we've got to address. And of course, we've got to learn how to develop community relationships and talk to people. Most of us don't talk to people much anymore. We talk to our computers. We talk to our cell phones. We talk to other things, but we don't talk to people. And nothing irritates me more that when I go to see my doctor, and she spends the whole time talking to her computer rather than talking to me. And I'm just saying that, so we've got to learn how to I'm not saying that the data that they're inputting and the data we're getting is not critical and not important, but we've got to learn how to do that while we continue to develop eye contact and relationship with our people, and we've not done that. So we have a crisis in healthcare today. We have a crisis of vision. We aren't visualizing what we need to do and what needs to go on. We have a crisis of anticipation. We aren't anticipating all the problems. I know you managers and users out there, and as you develop and work with the people that you're working with each and every day, that you anticipate the problems that they're going to run into as they talk to you and as they go and talk about it. And of course, last but not least, and you're doing this better than anybody else, a crisis of creativity. So we have to be able to manage our visual crisis, visualize the kind of health care we'd like to have for our country. What do we want? What would we like to have? We'd all like to have a community of healthy people in healthy communities. You can't have a healthy community if everybody in that community is sick. We'd like to make sure that all people have access to health care. These are the things, some of the things that we visualize that we really want and would like to have. They're the things that we'd like to have, as we move along. We already have the best technology in the world. We've got the best doctors in the world. We've got the best nurses in the world. We've got the best hospitals in the world. But we do not, I'll tell you, we do not have the best health. We've got cutting edge research. We've got immunizations for 13 different diseases. And yet we're having a measles epidemic all over the world. All over the country. We have more than 100,000 people die over the country. And more than 1,500 in the United States die from measles, a disease that's completely preventable. And the immunizations are safe. But why do we have these disease outbreaks? It's because we've not educated our people to take care of their health, and they're afraid they might get autism, or they might get multiple sclerosis, or they might get something else. And science says that's a lie, but we've not educated our people to get rid of that lie. So we continue to have major problems. So when we think about the truth related to our healthcare system, we spend more than $3 trillion, 18% of our gross domestic product, and we aren't healthy. Why? We don't try to prevent problems. We feel we're going to run out there and try and treat them. But we've got to prevent disease. And I know in your technology, you don't wait until you've got a major outbreak of germs spread all over before you run around and try and do something about sterilization. You teach people how to take care of those problems before. So we have problems with our system. We have problems with our providers, and we have problems with us, problems with our patients, and with our health illiterate society. Those are things I feel we must address if we're going to move forward. What are some of the things we've got to do? What are some of the strategies we've got to take? We've got to have some educational strategies. We've got to have some access strategies. We've got to have some prevention strategies. We've got to have some intervention strategies. We've got to have some strategies of compassion. Let me tell you a compassion strategy that happened when I was doctoring. We had a patient, walk from the Delta. Most of you may know where the Delta is in Arkansas, but we walked from Helena, Arkansas, to the University Medical Center, complaining of a very severe headache. And he had worn out his shoes and was almost to the point that he was barefoot. He got to the edge and came in at 4 o'clock on Friday afternoon. Well, you know what a hospital is like at 4 o'clock on Friday afternoon. The clerk was sending him away. But this neurosurgeon, I'll never forget him forever. He was coming through and he said, "Sir, what's the matter?" And he said, "Well, I've just been having this bad headache. I've been vomiting." He said, "I can't hardly see. I've about lost my vision." He said, "My doctor told me I need to come up to the med center." He said, "I've been walking for 2 weeks on the side of the road, and people have been giving me bread and sandwiches." He said, "I've worn out my shoes to get here." This neurosurgeon, normal neurosurgeons don't do this. But he said, "Well, let me look at you for a minute." He looked at him, saw he had severe papilledema. His sutures were spread. I want you to know, this neurosurgeon on Friday afternoon at a university hospital called in a surgical team and operated on this man. He had a meningioma, which is a benign tumor. It can cause you to die because of where it is. So I'm saying that's strategies of compassion. One person making a real difference in a human being's life. We've got to have political strategies. And you and I have got to educate our politicians. We've got to teach them what they need to know to make a difference in healthcare. We've not done that very well. The lawyers have done a far better job than those of us in healthcare have done. They feel every criminal has a constitutional right to a lawyer. But in our healthcare system, do we feel that every patient, every human being should have a right to a doctor or to healthcare? I do. I think most of you in this room feel that. But you know that that's not what's really happening. And of course, last but not least, we need to have strategies of leadership. I think your CEO understands that and knows what that is. First of all, to have strategies of leadership, the 5 C's of leadership are clarity of vision. You have to know what it is, know what you want to know, what you need to know, and know how to get there. That, to me, is clarity of vision. And you can see by the way you've been moving along that somebody, if it's not him, if you don't have it yourself, what you do is you get a lot of bright people around you so they can make sure you get there. And you get. For the second C, you've got to be competent. You can have all the vision in the world, but if you're incompetent, you can't get it done. For the third C, you've got to be committed. You've got to be committed to make it happen. You've got to be consistent. When you're going out, setting up and training managers and training your users and getting everybody on board and involved, you can't go and say, "Oh, we're going to do it like this today," and you come back tomorrow, oh no, I changed my mind. Why don't we do it this way? You've got to be consistent, and you've got to get everybody on board. And last but not least, if you're going to be the leader, somebody, most of you know, has to be in control. So when you think of your role as a transformational leader in healthcare in the 21st century, let's think about the word leader. First of all, you got to listen so you can learn, so you can lead. You can't teach what you don't know, and you can't lead where you won't go. So you got to go out there. You know, you can sit and talk to somebody on the phone all day long and not understand their problem sometimes, but if you go out there and on board and looking, you can often figure it out in a few minutes. You've got to educate and mentor. You've got to be aware of the problems, become advocates for the problems, and develop an action plan that's right for that consumer, for that hospital, for that manager, whomever you're trying to lead. You've got to have what I call determined boldness. I want you to tell you, as your Surgeon General sometimes, I had to have what I call determined boldness. I felt that I was your Surgeon General, that I knew more about what I was talking about and about dealing with the problems that I was talking about than any politician that I was talking with. And I was going to do what I felt I needed to do. Well, you know, you get fired when you do that. But I always tell people, you know, you do what you know is right. You do what you should do, and when you do what you know is right and what you should do, you don't worry about it. So even though I got fired as your Surgeon General, I want you to know I did it the best way I knew how. And if I had it all to do over again, I'd do it the same way. I did it right the first time. And I think, we have to feel like that. And if when you do something you're wrong, admit you're wrong, and say, well, you know, I was wrong. I made a mistake. We've got to evolve into what we want to be, the kind of healthcare system we want to have. We don't have it, but we have to make sure we evolve into that kind of healthcare system. You got to reach out. You can't keep it all to yourself. You got to reach out and be responsible. Take some risk. You don't have to take as many as I took, but you have to take a few risks sometimes. And we've got to be successful. Can't afford to fail. The most valuable resource we've got is our people. And so you've got to make sure that we don't fail. So I'd like to leave you with an old Igbo saying, and I'm left plenty of room for questions if you have any. It says, not to know is bad. Not to want to know is worse. Not to hope is unthinkable. But not to care is absolutely unforgivable. And I feel that because we care, we're going to work hard to make sure that we have healthy people in healthy communities. We're going to work hard to make sure health care is available, accessible, affordable, and safe. We want it to be prevention-oriented, patient-centered. We want it to be equitable. We want to eliminate disparities. We want it to be transparent. And last but not least, we want all people to live long and healthy lives. We don't want to just live longer. We want to live better. And always remember that a society grows great when old men and old women plant trees under whose shade they know they'll never sit. Thank you very much. Thank you. If you have any questions, I probably don't have answers, but I'll try. The one thing everybody knows, I always got in trouble for answering questions. Okay. How many of you remember why I got fired? What? Because I did it right the first time. That's right. But I was fired because I was giving a talk at World AIDS Day on sexual health, and I was asked a question, and I was asked if I felt about teaching comprehensive health education. And a psychiatrist wanted to know if I felt that we should teach children or teach about masturbation. And I said that masturbation was a normal part of human sexuality, and that we should teach them that it's normal, and that it won't make you go blind. It won't make you go crazy. It won't make hair grow on your hands. And you know you're having sex with somebody you love. Well, 80% of men masturbate, 70 to 80% of women masturbate, and the rest lie.
Surely there's questions now.
Stand up, I can't. Yes, go ahead. We can't, I can't see.
One more time.
Oh, as a Surgeon General, the thing that I found most challenging in the job is the ability to do the job and not let it become political. And everybody, wants to tell you their beliefs and what they think and what we should and shouldn't do and what we can't afford. Well, the problem is we can't afford what we've been doing. When we had the highest teenage pregnancy in the industrialized world, when we had, we was spending billions of dollars on welfare and for unplanned pregnancies, and everybody wanted to talk about abortions. And I reminded them, I said, I have never known any woman to need an abortion that was not already pregnant. So let's teach people how and let's prevent unplanned pregnancies. I want everybody to have as many babies as they want. If they want 20, have 20. That's all right. But I would like to have planned, wanted children. Yes.
My question is, with the new laws about abortion in all the states that are making it illegal, what is your opinion? Do you think that is the correct vision for our country to be moving toward?
No, I feel an abortion is a decision between a woman, her significant other, her doctor, and her God. And I feel the rest of us, we don't know enough, we aren't good enough, and we don't love enough to try and sit in God's judgment seat and make decisions. Do any of you think we're going to get health care this year? I mean, oh, go ahead. No, how many of you think we should have health care for everybody? Everybody. Most of the hands went up. And I think health care should be a human right. I think, I don't think any of us, I don't think anybody, I don't even think people who are saying they're against it. If they saw somebody out in the street with a broken arm, that they wouldn't try and get them to a hospital and get it fixed. So what we have is what we do right now is we really have sick care for everybody. The problem, what we don't have is health care. And so we need to try and improve our health care. And we've got to educate our people so they can improve and take care of their own health. We can do more to improve our own health than all the medical discoveries in the past 100 years. Okay.
What was the highlight for you during your tenure personally as Surgeon General?
I don't know. But, well, I think the highlight for me, in public health, you have to remember change occurs slowly. And I really worked very hard on trying to reduce children having children. And we reduced teenage pregnancy in the United States. Not me, but, I was arm twisting, all the things you have to do. 69%. And I want you to know that's very significant, and that saved you a lot of money. Because you don't have to pay for welfare, you don't have to pay for health care, you don't have to pay for unplanned children. And I want everybody to have as many children as they want. So that to me was a real highlight, and I was very proud of that. I was very, very disappointed when the Health Securities Act went down, but I'm very pleased that we were able to get the affordable health care that we got, but that's not good enough. That was not complete. We need to make it complete, but we need to have primary preventive health care for everybody. Any other? You see, I really can't see out there, so if you have any. Yes.
You have a very long career. Where do you think healthcare became such a political issue, and what do you think really led from that?
That's a very good question, and I'm in some ways, I'm sorry. I prepared all these slides, but we've been trying to provide health care in this country. Do you know how long we've been trying to get comprehensive health care in this country for everybody? Since Teddy Roosevelt was the first to start trying, so that was what, 1908 or something like that? So we've been trying that long. And then Roosevelt came along. Teddy Roosevelt I think he ended up getting not Social Security, and then Franklin Roosevelt came along, and he was able to get. He was trying to get health care for everybody, and he was able to get. He got Social Security, and then Nixon tried, and Truman tried. Everybody has been trying, and the first. Hillary Clinton ended up getting CHIP, for children, the Child Health Act. And so we've been trying a long time. We haven't got, and there's no reason why we shouldn't get health care. It isn't that we can't afford it. It isn't that we have to reinvent the wheel. Other countries have done it. It's just that it's been such a political football until every time anybody brings it up, they get jumped on, and we all know that we need it. Yes. Okay. Well, one of the things that we've pushed, and they've even passed some laws, that we need to have comprehensive health education for all children from kindergarten through 12th grade. We need to educate our children to be healthy, and that we've not done that. The main reason we haven't done that, we're talking about, if you're talking about teaching them brush their teeth and scrub their hands and, don't get involved in drugs and sex, simple things, is because we feel that if we tell them about health, its health education has been transferred over to sex education. And we tell them, and we're going to teach them that, we might teach them something about sex. Well, I want you to know somebody needs to teach them something about sex. Well, I thank you all for sitting here listening to me. And I'm sorry that I didn't have my fancy slides that I literally really did make them.
I think you did. I think you did just fine.
But I thank you, and it's been a pleasure to have the opportunity to be able to talk with you. And I thank you for what you're doing and for the difference you're making. And I know that all the people out there handling surgical software and the managers and hospitals and the users certainly appreciate the wonderful things that you're doing to make life easier, to know that when they get ready to open up my head, that they'll have everything they need to make sure that I come out alive. Thank you very much.
We're having
Thank you.
We're having a welcome reception next door. Would you
Okay.
join us and
most
maybe
certainly
take
will.
some more questions
Sure.
next door? So
I
we're-
won't take as many selfies as our president can you imagine standing 4 hours doing selfies? But I will be very happy to take as many pictures as you want. But we don't have 20,000 people, so we don't have to worry about that.
we're going to be next door. Our welcome reception starts right now. And thank you, Dr. Elders, for a
Thank you.
wonderful,
Thank you.
inspirational
Thank you for
speech. We'll start early in the morning at 8 o'clock with Todd's innovations presentation, and let's enjoy our reception. Thank you, everyone.